Resident doctors halt voluntary work over unpaid labour. Resident Doctors Association of Zambia, RDAZ, has decided to withdraw voluntary medical services from public hospitals nationwide, effective Monday, June 2, 2025. The move comes as the association protests the government's alleged reliance on resident doctors to deliver essential healthcare without recognition or payment. RDAZ President Dr. Paul Chibwe stated that over 50% of public hospitals are currently dependent on unemployed resident doctors providing services under voluntary arrangements. Dr. Chibwe highlighted the government's apparent reliance on this volunteer work without official recognition or compensation for their contributions. This decision was not taken lightly, but was made in response to the government's continued disregard for our contributions and our concerns, Dr. Chibwe said in a statement. He explained that the lack of clear commitment and engagement from authorities left the association with no alternative but to cease voluntary work. Following careful consideration and consultation with its members, RDAZ made the resolve to withdraw all volunteer resident doctors starting Monday. Dr. Chibwe emphasized the urgent need to address the long-standing issue of unpaid medical labor and secure fair working conditions for RDAZ members. He appealed to relevant authorities to promptly address the matter to prevent further disruptions to healthcare services. Despite the impending withdrawal, Dr. Chibwe reaffirmed RDAZ's commitment to constructive dialogue and expressed readiness to engage with stakeholders to find a swift and lasting resolution.
The vital role doctors play in maintaining, improving, and promoting healthy communities cannot be overemphasized. However, some of these health practitioners are faced with challenges which call for engagements, and the absence of these engagements has necessitated the Resident Doctors Association of Zambia to withdraw all volunteer health doctors across the country until government addresses their concerns.
As of today, 2nd June 2025, we've downed twos. What UTS us from checking through, we have doctors have cooperated. Remember, this came as a collective agreement, and we've made sure this has gone through. We're not calling on government to pay people that volunteered. No, they went there by choice. We're saying the same way they went there by choice, we want to pull out by choice, because we've been covering a deficit that's supposed to be felt by the ministry. The deficit is supposed to be felt by the public, and public now reports to the relevant officers. But we've been covering this for some time now, and that's why we're pulling out. And yesterday's response, the minister mentioned volunteering is a choice. You can pull out anytime. Yet later on, he added to say government is going to prioritize volunteers. Isn't that now some sort of blackmail? Meaning you're saying, one hand you're saying people can leave, another hand you're saying if they leave they won't stand a chance of being employed. And today, as of today, I'm from having meetings with some of the SMSs from the UTH. We have HODs, and some of these people are telling volunteers to say once they leave they won't come back. If you don't need people, then why are you imposing such measures? If a volunteer is a choice, let us allow us to live by choice.
Stakeholders have also weighed in on the challenges faced by doctors.
The statement by the Minister of Health that the government does not have resources to employ the volunteer doctors, and that being a volunteer does not warrant someone to be employed is very, very insensitive, in that the manner in which the minister has communicated that information is not proper. I think it should have been more sensitive.
On Sunday morning, Health Minister Dr. Elijah Mchima addressed the media, and he echoed on the need for dialogue in resolving the issues faced by health practitioners.